Hi, I'm Steve. We're here and we welcome back Dr. Nario for part 2 of vitamin D. So Dr. Nario is with Biointegrative Health Center in Reno, Nevada. You can look him up online. I'm with Fitness for 10, co-founder. And hello, doctor. You ready to get started?
Hi, Steve. Thank you again for bringing me here.
Okay, so vitamin D part 2. What's significant about vitamin D? What's its functions in the body? What's it for? Why is it important?
All right, Steve. The initial part one that we had explained the basics of vitamin D. Now we're going to get into vitamin D a little deeper and explain to you a little more in-depth information about it. So vitamin D studies, so medical studies have shown that vitamin D levels that are higher are always beneficial. I'm going to discuss later on the normal values, but when I talk about vitamin D, I want to make sure that our audience know what I'm specifically pertaining to. So there are two types of vitamin Ds on your blood test. So this is a whole different discussion, but I want you to have this knowledge that when you go to your doctor, you ask for the level of 25 OH, not 1-25 OH. For the reason that 25 OH is the metabolized vitamin D after it goes through the liver. And 1-25 is the vitamin D that goes through the kidneys, and it's a metabolite. That's why it's always accurate to get the one that came out of the liver, which is 25 OH. That's why you ask for from your doctor. So what are the advantages of having ample and good amounts of vitamin D? Number one, less chances of dying of any medical condition, especially cancer, specifically colon, breast, and ovarian. So I'm not saying vitamin D will save you when you walk through a heavy traffic freeway. It's more of really more of the medical conditions. Next would be falls, fractures, and even acute respiratory infections are lowered and reduced. And next would be asthma. 50% of exacerbations will be lessened. And also gut issues and inflammation, such as inflammatory bowel disease, or even sometimes IBS. It improves their quality of life. Another one would be better physical performance and also lowers chronic pain, especially for the elderly, at the same time enhancing their mood. And another one would be autism. Autism in relation to vitamin D had led to improved behavior, eye contact, and longer attention span.
Okay, so you talked about levels. What's a normal level of vitamin D and how do we measure it? Is it a blood test or tell me about that?
All right, Steve. The known lab number of vitamin D normal is 30 to 100 nanograms per deciliter. And this is, I'm giving you the example of our Quest normal value, Quest labs. The thing here is it's misleading for the reason that they're saying that 30 is actually part of normal, meaning it's low normal. But the fact of the matter is it's really not. The ideal number where we want you to be is at least 60 to 100 to attain all the benefits that I mentioned. The thing here is, I'm sure you heard of the RDA, Required Dietary Allowance. The recommendation is to take in 600 to 800 international units of vitamin D to reach at least the number of 50. But when you reach 50, you only get the benefits of bone health and not all the things that I mentioned. That's why we want to target higher levels. And how do you achieve that? At least 1,000 to 2,000 international units a day to get to the level of 75. And then that will bring you to that level of getting all those benefits that I mentioned. But the thing that I want to take note of, it's not standard for everybody. At least we do a higher dosing for the ones who has medical condition. So at least 3,000 international units or more for the people who are obese, who are overweight, for the people who are over 70, especially if they have neurological or cognitive deficiencies, histories of falls, balance problems, or heart and blood pressure issues.
Okay, so how do we get vitamin D? I mean, is there natural sources? Can we get enough of it through food? I know that sunlight helps, so what are the sources?
All right, that's a very good question. That's one of the more common questions that I get. So we always hear about sunlight being the closest source for vitamin D. It's the cheapest source, actually. Studies have shown that native African people who are half naked, so they're like in the safari in the forest, and they're not flashing, but on purpose or being in a nude beach. It's just their lifestyle in Africa, and they're always exposed to the sun. And this led them to have at least more than 100 nanograms of vitamin D per mil in their blood. So that's actually more than the 600 to 100 normal that I just mentioned ago. Sadly, we are not in Africa. So I'm not promoting you to be naked out there and you don't want to be arrested for indecent exposure. The problem here is if we get into the sun that long, we will encounter rapid skin aging. We will develop skin cancer, especially for the ones who are pale or light skinned due to the harmful UV rays. And so we're in North Africa, under exposure to the sun and paleness has been a stigma of looking dead. But the thing here is people are so innovative that it led to the invention of tanning beds. Tanning beds, instead of helping, actually led to the highest risk of melanoma, which is a skin cancer, type of skin cancer, due to the abundant delivery of UV rays. It delivers more UVA than UVB, so this is ineffective in producing vitamin D from the skin, proving supplementation is better than sun exposure. And again, we can get it from food sources, but I guess in different quantities, such as seafood, which is cod liver oil, swordfish, salmon, egg yolks, mushrooms, and even beef liver.
Hmm. Okay, so I know that I take drops and I take vitamin D3. Then there's vitamin D2, B3. Tell us about the difference and what we should be getting.
Right. So the thing that I mentioned before in our first topic, I think I did differentiate D2 and D3 in terms of the sources. It's just more of the yeast versus the plant sources. The thing here is there's really not much of a difference if you're talking about effectivity. If you're taking both D2 and D3 at the dose of 4,000, at least 4,000 international units a day, they're almost the same in terms of effectivity. It differs when you start to increase your dose. A weekly dose of 50,000 international units, which is given a D3, which is given to a patient who is severely deficient, versus 50,000 IUs per week, is now had shown that D3 is more superior to D2. So that's where you draw the line. When you go to higher doses, D3 is way more effective. And a good example for you would be in our clinic. 6 out of 10 patients that I see actually is vitamin D deficient. And of course, when these patients are symptomatic, as we call it, or actually visibly or physically sick, they need immediate boosting rather than doing it slow for small doses for a certain number of days. That's why we give this vitamin D3 through muscular injection to boost that number up faster than oral supplementation. So we have a protocol here in the clinic, and if you are a patient, we definitely will explain that to you in a little more in depth. But it's a combination of intramuscular and oral supplementation to put your vitamin D levels back, and eventually you'll end up just doing oral maintenance for your vitamin D deficiency problem. Common available doses in the market for vitamin D would be around 400 IUs as the smallest dose, and the largest one would be 10,000, and I'm talking about oral supplementation.
Okay, so good information. So vitamin D is obviously very important. Is there anything else you can tell us about, taking vitamin D, the different ways to take it? Or you said injection is good. What
Mhm.
about, is there a certain time? Can we take it before we go to bed? Can we take it when we wake up in the morning? Or anything specific about that that we should know?
Right. So there are so many recommendations on when to take vitamin D. I've heard so many things. It's empty stomach, no food at all. But studies have shown that vitamin D absorption is increased by 50% in
Hmm.
relation to the blood levels when it goes up when it's taken with the largest meal of the day, for the reason that vitamin D is a fat soluble vitamin, so it binds with the fat so that it can be facilitated to enter our system in the easiest way possible, and that's with a meal, of course. And overdosing on vitamin D is very far from happening, the reason, especially if you're taking supplements or sunlight, that you're going to burn first. And extremely high doses usually are related to cataracts, kidney stone formation. But again, this we're talking about very long periods of time.
Wow. Okay. Vitamin D is important. So this concludes our part 1 and part 2, vitamin D. We appreciate your knowledge, Dr. Dr. Nario, Biointegrative Health Center. And we thank you, and we'll see you next time.
Thanks, Steve.